got patients I've taken care of for 30 or 35 years now. The older folks will remember Marcus Welby, who had his practice in his house, and he seemed to have all day for each patient. Well, that's impossible, but time to spend with the patients and really get to know them and their lives, and that's very important when you're trying to take care of them. So over the years, as practice evolved, it got to be so busy that it was hard to get to know everybody the way I really would like. When the opportunity came to join MDVIP and affiliate with them and open my own practice, I thought I really should take it.
I had a car accident. Dr. Laughlin got everyone involved, got to the root of the problem, got me fixed. I've never forgotten that. When he moved into his new practice, it was really a no-brainer.
So there's an $1,800 a year or $150 a month fee to join the program. Why is that a good idea? I think it's about time as well as the wellness program.
The detail was unreal when I got my physical. He spent an hour and a half explaining my physical in depth.
Well, I'd been seeing him for over 20 years, and I knew how good of a doctor he was. Having access to somebody with the credentials and the experience that he had had and the things he had helped us get through, which has been major in the last few years, there wasn't a question in our mind that we didn't want to go with him.
Hi, my name is Shannon Chambers, and I'm the Executive Director of Neighbors Along the Line. We serve the community by meeting their basic needs. We have a food pantry, we have a medical clinic for uninsured patients. Dr. Laughlin is one of my favorite persons on this earth.
Dr. Laughlin is quite the character. We adore him here. Dr. Laughlin's the kind of doctor I can imagine if he could still get away with house visits, that's probably the kind of medicine he would prefer.
We have patients who specifically want to see him. I think he makes them feel valued.
And so he'll sit down with them and just spend time figuring out not just what's going on medically, but what's going on in their lives.
He is 100% your advocate. 24 hours a day, 7 days a week, anywhere he is in the world or anywhere you are in the world.
They can call me whenever they like. When I was on vacation 3 weeks ago overseas, I got 4 patient phone calls, which I called them back, although it was 1 in the morning where I was, but that's okay, that's part of the agreement. But when they call me, I know who it is because they're on my contact list, so I'll answer that call.
I love that I have the convenient access to my doctor. I was having a CT scan and they couldn't find the vein and had 2 different people, and I became very upset and just told them to please stop, that I wanted to call my doctor. And they looked at me like, yeah, lady, you're not going to be able to get your doctor on the phone. And so I just stepped over and I called his cell phone, and he didn't answer immediately. But it was less than 2 minutes. He called me back from Arizona. He was on a trip, on vacation with his wife and family, and he said, what's going on? And I said, they cannot get this needle in my arm. And he said, do you want me to talk to them? And the nurses in the CT scan room were listening, and you could just see the look on their face. They were shocked that he was on the phone. It was like total personality change. We are going to help her, and we're going to get this done one way or another. So it is just, you can't put a dollar amount on it. It's invaluable.
Dr. Laughlin has been nominated for Oklahoma's Best Doctor, I would guess at least 10 times, and I definitely could see why, and I'm sure his patients would echo the same. He gives them guidelines for not only treatment of medications, but get to the gym, stop eating the birthday cake every day, and things like that. And so because that he has that respect from the patients, they listen to him, they'll listen to ideas that he has about health and wellness, and not just about, more pills to take.
You get same day, next day access, the full wellness program, contact with me. It's really quite a difference in every way from the regular practice. And then here's the best thing. The biggest difference, and I've been doing this with every patient, we get everything done when they're here for their visit, and what do you suppose the last thing I ask them? Is there anything else? Because we're not in a hurry, and we're not trying to push on to the next patient right away. We have that moment to say, really, wasn't there was there anything else you had in mind? And most of the time people say, no, that's it, you covered everything. But there's maybe that thing that they really weren't sure if they really felt comfortable going there, and that can be the most important part of the visit in many cases. So that's a huge difference from the old days of walking out the door and hoping to get into the next room before somebody grabbed you. I'm not here to just help you stay alive. I'm here to help you live.